Hello, my name's Dr. Mark Bailey. I'm Interim Chair of Council and Clinician who codes, and I'd like to talk to you today about HealthENV, a very exciting project that we are building in the Faculty of Clinical Informatics. Now, the elevator pitch for this project is an educational environment for clinical and digital students and practitioners to practice building and using health technology similar to hospital, GP practice, and social care settings. Here's a mock-up of the environment where you can choose from, as I call it, a health stack, so a combination of different technologies, repositories, and EPRs and so on, which you can predefine and then spin up. And here's an example of it's being started up. You can do it via the command line, of course, if you wish, and then up pops, for example, an open source EPR like Barmy. So the design of HealthENV is very much using Docker container ideology, and within this a single data layer with APIs connecting to your front end different functionality, for example, the EPRs, PACS, PAS, labs, and maternity, and so on. And very much, I'm very much an advocate of open source, so open code, open standards, learning, and if this environment is used in real life settings, open data through trusted research environments and so on. And this is very much enabling vendor neutral architecture, adaptability, extensibility, cost saving overall, and build once, share many. Benefits for health and care students include as I like to put it, a flight simulator where students, prior to being let loose on the wards when they fully qualify, can learn how to use, for example, EPRs and PAC systems and so on in a safe environment with fake patient data. And why not have exams around EPR usage and also having interesting patient cases. So, for example, a ward with a cardiology ward with patients on, and you can take the patients through management of their different conditions. For example, a patient that may have myocarditis, but you may have never come across this word before. And so you can have just-in-time learning from this and learn further about this. So there's also clinical education from this work. And there's benefits to computer science students and health tech students, so they can learn about the different health technologies, they can break and rebuild and improve upon the technologies that we have. And there's benefits to the NHS if what's being built in HealthENV is found to be beneficial for real life settings. This can be taken forward to help with trusts and GP surgeries and so on. And there's also benefits for data analysts where they can practice the different techniques that they need or analyze big data to help with policies and so on. And there's benefits for the wider health systems across the globe, where other countries can use the technologies and learnings that we found. And also we can help deliver these technologies to developing countries at much reduced cost. And there's also benefits for industry where they can, for example, build a new app, spin up a new environment where they might want to deploy said app and see if there's any problems with the app and debug these issues. Now, a very exciting area alongside HealthENV is its networks. Think of this as a Facebook for health. So this is an example of Gloucestershire Hospital, which is my local hospital, having its own profile page showing which different technology they're using, which ones they're currently working on, what innovations they've got going on. And this enables other trusts and GP practices and so on to see what learnings they've had, what mistakes they've made, but also how they can collaborate and work on things together. So you can have a GP surgery as well, the local ICS, and also industry where they can show their wares and help people understand what different technologies they have and help with tenor and so on. And then why not a patient area where patients can come and research different apps and technologies that are available for their disease. So here, for example, diabetes, and you can have the FCI stamp of approval for apps and technologies that meet standards that the FCI is currently working on. And it's the things that I haven't thought about, the things that the community of HealthENV would make happen, which is actually the things that I'm very excited about. We've had interest from many different people. We've had Dave Turner, Sonia Patel, Marcus Bohr, Mark Wardle, Ian McNichol, and so on. And many medical students I've spoken to are very interested in this HealthENV, the sandbox EPR for learning. All of this work aligns with high up NHS partners, including Tracy Ayres, who's spoken about this at the recent FCI conference, David Turner, who spoke about the Sandbox EPR at the last Clinical Informatics Congress, and Ben Goldacre in his review last year spoke about a sandbox for analysts to practice their skills on. And there's many environments already out there which we can learn from and expand on as well, and here's just a small list of them. So what is needed for this environment? We need workforce and time, we need servers, or probably the cloud, and we need financial backing. And so donations is a possibility, grants, and individuals, universities, and industry paying subscription fees for using the service. So if you're interested in this project or want to help build it even, or donate towards it, please contact the FCI at info@fci.org.uk. Thank you very much for your time.